All right, now let's talk about one of the most common viral illnesses we see in the United States, influenza. Go ahead and grab your Davis MedSurg book, turn to page 461, and grab a blank exemplar worksheet and study along with me today. Influenza is one of the most common viral illnesses we see in the United States. It's typically worse in the fall and winter. And in recent years, the CDC tracks outbreaks every year, and in the 2017 to 2018 year, we had over 48 million cases, which resulted in almost 80,000 deaths in our country, and cost us a lot of money in the healthcare world too, 22 million doctor visits for influenza that year. Now, interestingly, with the pandemic and people masking and social distancing and staying home when they're sick, we've actually seen very little flu in the last bit, but influenza is here to stay, and it's good that we know how to care for patients with this viral illness. Now, in terms of pathophysiology, influenza is a virus. It can be categorized as influenza A, B, or C. It's transmitted through droplets, and the most common ones that we're going to see are influenza A and influenza B. Signs and symptoms are fever, headache, sore throat, really bad nasal congestion and a cough, myalgia, which means body aches, muscle aches and pains, malaise, which means fatigue or feeling really tired and run down. And all of these symptoms are consistent with the flu. It's kind of like your typical upper respiratory infection, your typical cold, just a lot worse. Doctors are able to diagnose this medically through a viral culture. And also just based on the patient's signs and symptoms and maybe who they've been around. The viral cultures are done in the back of the nose with in the nasopharynx, right where the back of the nose passages and the mouth passages kind of meet. And if you've ever had one of these swabs, it feels like they're swabbing out your brain. It's the same for the really deep COVID swabs. But we're able to get a rapid test result back, usually within half an hour, to say whether or not that swab was positive for the flu. Now, treatment, really the biggest thing is prevention, and as nurses, we want to really encourage patients to get vaccinated. The vaccination needs to happen every year because there are mutations, and they have to hypothesize, kind of like a weatherman, what the worst strains of the flu is going to be the next year, and that's how they make the vaccine. And so the new vaccine typically comes out sometime in July, August, maybe September, and patients need to get the new one every fall. Typically September, October is ideal so that they have coverage over the full flu season, especially if patients are at higher risk for having complications, like the elderly or patients who live in long-term care facilities. They should really wait till September or October to get their flu shot, but really by the end of October, everybody should be done with their flu shot. So if we can't prevent it, if patients have a breakthrough case after being vaccinated, or they chose not to get vaccinated from the flu, we do need to help these patients get managed. Now, this is a virus, and so we don't give antibiotics for viruses, right? Antibiotics are for bacterial infections. Viruses, we have to treat the symptoms. So we give antipyretics, things to help bring the fever down, like Tylenol or ibuprofen. Analgesics help with the body aches and pains. And again, Tylenol and ibuprofen do that as well. Now, we do have an antiviral on the market. You might have heard of it, called Tamiflu. And it has to be taken within 2 days of the symptoms starting for it to be able to work. Now, this antiviral doesn't really cure the illness. You still have to kind of let your body fight it off. But the Tamiflu can reduce the severity, meaning how bad the symptoms are, as well as the duration, meaning how long is it going to last. So Tamiflu can be very expensive, even with insurance, but if taken within the first 2 days of symptoms, it can help shorten the duration and severity of illness. The most common complication, it's going to happen in those who are at higher risk for problems, the very young, the very old, is that the influenza, that viral infection, turns into a pneumonia, either a viral pneumonia or even a bacterial pneumonia, where the infection enters the lungs and settles down in the lungs, and then we see all the same signs and symptoms and complications that one would see with pneumonia. As always, let's go ahead and review the nursing process and how, as nurses, we approach patients with influenza. It starts with assessment. What are we going to assess or notice if we think someone has influenza? We're going to see that inflammatory response from the body from the virus. Things like headache and cough, nasal congestion, sore throat, fever, and malaise, which just means overall not feeling well. Nursing diagnoses include ineffective breathing patterns. Their respirations can become involved. Decreased activity tolerance because they feel junky and they don't want to walk around and do stuff. Alteration in gas exchange as the influenza can kind of sit in their lungs or in their upper respiratory tract. And a fluid volume deficit. Anytime a patient has a fever, they're at risk for fluid volume deficit as it takes more liquids and fluids to get through the illness. So what are we going to assess? What are we going to notice on someone and monitor for in someone that we know has influenza? Well, we're going to watch their vital signs. We're going to look at their neurologic function. Are they alert and oriented ×4, or are they altered? We want to look at their breath sounds, their general appearance. Do they look well or do they look not well? Looking for things like cough, nasal congestion, sneezing, and rhinorrhea, which means a runny nose. We're going to check their peripheral pulses to make sure that they're still getting good circulation and perfusion. And then we can look at lab values, especially things like their WBC, their white blood cell count. Or also their flu swab, right? Their rapid flu swab that we did at the way back of their nose. Okay, in terms of actions, what are we going to take for actions? Well, we're going to initiate isolation precautions. Patients with influenza should be on droplet precautions. We can administer humidified oxygen if ordered and the patient needs extra oxygen. If patients are ever having a hard time breathing, sit them up. They're going to get better expansion of their lungs and they'll be able to breathe in more oxygen. So semi or high Fowler's position. Give any medications as ordered. Provide adequate fluid intake. We want to push fluids. Consider their nutritional status. And obtain those viral cultures, those flu cultures, to make sure that they really do have the flu. So remember, for droplet precautions mean a mask when you're with the patient's room in addition to standard precautions. And so in the acute care setting, patients should be in a single patient room when available. And we should put a mask on as soon as we get in the patient's room and make sure that we're at least 3 feet away from them when we're donning and doffing all of our PPE. Nursing interventions. We need to teach good hand hygiene. Remember, transmission is droplet, and we want to make sure that we're trying to stop the spread of this infection. Tell them to stay home if they're sick and wear a mask. Disinfect frequently used surfaces, things like door handles. Limit contact with others when they're sick. Tell them to report any shortness of breath if it's getting worse. If you have more shortness of breath, come to the ER or call the doctor. Make sure that they're pushing fluids as their body needs that to help get over this infection. We're going to teach them about any medications that are ordered and encourage that primary prevention, preventing this from happening in the first place by making sure patients get their flu vaccine annually, especially in September or October. How do we know we did a good job? Well, we evaluate. That's the last step of the nursing process. We want to make sure that our patients have had their flu shot. That's the best thing we can do to help them avoid influenza. And then if they do get influenza, we want to watch that oxygen status, just their pulse oximetry. Is it back to their baseline? Is it back to the normal level that they had before they got sick? That means that, we've done a good job and all of their symptoms have resolved. All right, that's all you need to know about influenza. We'll see you in class. Thanks for listening.